This is the third video about rethinking fertility. Why is it so important? Well, we have, and this video is about PCOS women who go for IVF. I mean, we have quite a few PCOS patients who decided to go for IVF, and they said that well, clinics welcome them with open arms because they have a lot of follicles, they can collect a lot of eggs, and what our clinical experience tells us is that many of them are disappointed, and quite sadly they come back and said that, well, I mean, yes, a lot of eggs are collected, but most of them are not useful and there's no embryo developed. So we started looking into this, and we actually found that although the study so far has in fact demonstrated that PCOS patients do have a higher success rate for IVF, the success rate is calculated on the per embryo transfer. Is not on intention to treat, which means that it's not on as soon as you start stimulating, you should count failure from that point, not counting failure only after embryos are developed. And what do we mean by that? Well, I mean, women go for stimulation, sometimes they don't like the drugs, their stimulation cycle is abandoned, and that's a failure. And women went for stimulation and no eggs are collected, and that's a failure. And women went for stimulation and no embryos are developed, that's a failure. So there's a lot of failures before embryo transfer. And the general consensus is that the embryo transfer statistics are at least 20% higher, which means inflated. You actually compare that with the intention to treat, the per cycle started. And it's also well known that PCOS women tend to have more failure at the earlier stages. That means that no eggs are collected, no embryos are developed. So the 20% is likely to be even higher than 20% inflation. So you actually factor in the 20% or even higher than 20% inflation. This completely cancelled out or even reverse the claimed statistics, which is PCOS women have a higher success rate. So if you do go for IVF, you go PCOS, you need to ask the right question. When the clinic are presenting you with success rate, is it per embryo transfer or is it per intention to treat? And so rethinking fertility is not just about having a different belief, but it's also about asking the right question. And that's what we encourage you to do. Rethinking fertility is so important because people spend a lot of money on expensive procedures, sometimes are misled by numbers that because they haven't actually been able to ask the right question. So we very much encourage you to do that, and that's what my book is all about.